If you don't answer them today, please let us know because there's also
Your mic.
a box for that to engage in questions. And lastly, we want to ask you to please complete the questionnaire at the end of this session. This information will provide us some feedback. Thank you in advance for your feedback. Also, without further ado, I am pleased to introduce today's speaker, Hannah Harold, from the Wyoming Department of Health, where she currently works as the Chronic Disease Prevention Program Manager. She directs statewide efforts around chronic disease prevention and management. She has conducted many educational sessions on diabetes, thus we have asked Hannah to walk us through this Preventing Type 2 Diabetes Guide that was created by the CDC and the AMA to answer any questions that you have regarding it. Hannah has also a diverse background of education and experience in public health with a focus on promotional and behavioral science. She obtained her Master's of Public Health and Master's degree from San Diego State University, where she taught public research methods and assisted with obesity prevention, sexual health, and chronic disease research studies through various research centers. Hannah is also certified as a health education specialist at the National Commission for Health Education Credentialing. Thank you, Hannah, for partnering with us today, and we will turn the call over to you. Thank you.
Thank you, Grace. So I'm really excited to be here today talking about the Prevent Diabetes STAT Toolkit and how it can be used in a clinical or community setting throughout Wyoming. As Grace said, I am the Chronic Disease Prevention Program Manager at the Wyoming Department of Health. And so diabetes prevention and management is one of the largest focuses of my program. So today I'm going to be reviewing a toolkit that was developed by the American Medical Association and Centers for Disease Control and Prevention, and kind of going over all of the resources available in that toolkit and how you can implement them in a community or a clinical setting to help your patients prevent diabetes. So the objectives of today's webinar are to understand a little bit more about the prevalence and the burden of type 2 diabetes in Wyoming. The content of this webinar will focus specifically on type 2 diabetes, simply because type 2 diabetes is the only type of diabetes we can actually prevent, type 1 being something that is genetic, and you see it in youth, and it's not preventable. It's an autoimmune condition. So focusing on type 2 diabetes, we're going to look at the Prevent Diabetes STAT Toolkit developed by AMA and CDC. And then using that toolkit, learn a little bit more about specific resources and tools we can use to identify patients that are at risk for diabetes, refer them to appropriate programs such as a Diabetes Prevention Program or a DPP, and then increase enrollment and participation in those programs. And then, like I said, we'll be looking at some of the resources available to healthcare professionals to help them screen, test, and act today to prevent diabetes. So for a little bit of background, this map shows the prevalence of diabetes in Wyoming. As of 2016 BRFIS data, Behavioral Risk Factor Surveillance System data, our diabetes rate was about 8.3%, and that's our prevalence rate throughout the state on average. This map shows cumulative data from 2011 through 2015 data, which is kind of one of the better representations of the spread of diabetes throughout our state. Since we do have some counties with extremely low populations, we do need to look at multiple years of data to get a better idea of where we're seeing higher cases of diabetes. As you can see by the darker red colors, there are certain parts of the state that do have significantly higher prevalence of type 2 diabetes than others. Albany being, a younger college county, we have quite a lot lower rates. And then if you look at some of the counties surrounding the Wind River Indian Reservation, like Fremont, Hot Springs, Washakie, and then a little higher north in Bighorn, we see kind of a central area there that has a higher prevalence rate of diabetes. The cost of diabetes in Wyoming is pretty significant, and it's just like this in every state. Diabetes is a very expensive chronic disease for those that have it. In 1 year, the cost of diabetes for just inpatient costs alone is about $232 million for the state of Wyoming. And then if you look at an individual person who has type 2 diabetes, they incur an average of about $7,900 in medical costs per year. So on top of the burden of diabetes on a person's life, quality of life, activities of daily living, things like that, it's also a very expensive disease for someone to have. So what is the National Diabetes Prevention Program? I'll use a couple acronyms. NDPP is the nationally recognized program, which means it's a program that has been certified or recognized by the CDC. DPP is just another short name or short acronym I'll use for that. So before I give this overview, I'd like to do our first polling question and find out who has heard of the National Diabetes Prevention Program. So I'm going to go ahead and start this poll. And if everyone can see that on their screen, please go ahead and vote as if you've ever heard of the National Diabetes Prevention Program. Got a few more votes coming in. All right, so if we look at the results there, it looks like the majority of people have not heard of the National Diabetes Prevention Program. Some people have heard of it, but we see a little bit more people who have not heard of it than have. All right. So as an overview of the National Diabetes Prevention Program, this is a lifestyle change program. So it really helps participants focus on changing their life, looking at physical activity habits, looking at nutritional habits, stress and other factors, and how they can really change these different behaviors in their life to better reduce their risk of type 2 diabetes. The program does follow an evidence-based CDC-approved curriculum. The CDC does have 2 standardized curriculums that programs can use. Programs can also develop their own curriculum if they'd like to maybe tailor the curriculum to a specific culture or specific population group. They can do that, but the curriculum must be reviewed and approved by the CDC before they can implement it. The National Diabetes Prevention Program is designed for people that have already been diagnosed with prediabetes or are at risk for type 2 diabetes based off a variety of factors such as their BMI, their family history, maybe a history of gestational diabetes for women who've had that during pregnancy. And the program is split up into 2 sections. There's the core phase section and the core maintenance phase, or the core phase and the core maintenance phase. During the core phase, participants attend 16 classes. And so these 16 classes take place over 16 weeks that are spread out during the first 6 months. So it's not 16 weeks in a row. Essentially, over the first 6-month period, there will be 16 classes that a participant can attend. And that's the core phase. Then for the second 6 months of the program, it's the maintenance phase. And that's where classes slow down a little bit. They become monthly classes instead of weekly classes. And a participant will attend 1 class a month for these last 6 months. And they're really focusing on maintaining these lifestyle changes that they developed in the first 6 months. And I'll go into a little bit more detail about the curriculum because it can be confusing. But really, overall, the program just focuses on healthy habits. So in looking at the curriculum, these are some of the options for curriculum or the curriculum classes that are presented in those first 16 weeks. So it is a 1-year program. And it's kind of confusing when you say 16 weeks because they actually take place over 6 months, but it is 16 classes during that first 6 months. And so you can see these classes cover things like physical activity, healthy nutrition, learning about that balance between calories in and calories out and how that can affect weight gain or weight loss. Looking at things like managing stress, or for people that lead busy lives, how they can actually find time for fitness. And then a few other things that are really important to disease prevention, such as getting a good support system, or how do I eat healthy when I'm not at home, if I'm traveling or at a restaurant. So these are the first 16 courses that are presented to participants during that first 6-month period. During the second 6-month period, they move into maintenance. And so during this period, there's only 6 courses that are required to be presented, but they can present more than that. A program can offer more than that if they'd like. And these are some of the options in that curriculum that programs can provide. So again, it's a little bit of review about things they learned during that first 6-month phase of the program, and how to handle things that, challenges they might encounter. So like when weight loss stalls, anyone who's lost weight knows that there's going to be times when maybe your weight loss slows down and it can be, difficult to continue having that motivation to push forward. And so the second 6 months really help patients with maintaining these lifestyle changes that they've already developed in those first 6 months. Like I said, the program is evidence-based. It actually came about from a very intense NIH randomized control trial. And so this trial took place quite a while ago. I think it was early 2000s that it took place. And the NIH divided up people into 3 different groups: a control group, an intervention group 1, and an intervention group 2. Now, each of these groups had a different interaction with a provider or a different medication provided, or for one of the groups, a placebo. So the control group didn't get anything other than a placebo. Intervention group 1 was provided metformin, which is kind of the standard medical or prescription treatment. And then intervention group 2 got what they called intensive lifestyle coaching. And so this was individual counseling and motivational support on diet, exercise, and behavior modification. And they studied these 3 groups to see how these different interventions or placebos impacted the outcomes for these patients. After 3 years, they found that those who were in that intensive lifestyle coaching group, those that had a 5 to 7% body weight loss, which isn't much. If you're looking at someone who's 200 pounds, it's not much weight. It's only 10 pounds to get that 5%. So it's not huge. But those who did achieve that 5 to 7% body weight loss reduced their risk of developing type 2 diabetes by 58%. And that's out of everyone. If you look at the aging population, 60 years or older, it reduced their risk by 71%. And that's a 3-year outcome. So that's a pretty significant outcome 3 years after the program. And then they followed up 10 years later, and they found that compared to the control group, those that were in that intensive lifestyle coaching group had a 34% decrease in their prevalence of type 2 diabetes. So this was the foundation of the National Diabetes Prevention Program. Again, just comparing the outcomes between those 3 groups. If you look at the placebo group compared to the metformin, compared to the intensive lifestyle intervention group, again, the most significant outcomes in reduction of risk of developing type 2 diabetes was that lifestyle intervention group, and that model was then translated into the National Diabetes Prevention Program. Really, the only change they made was a change for sustainability, whereas instead of offering it individually, they modified it into a group program. Now, looking at the availability of these National Diabetes Prevention Programs in Wyoming, currently we have 5 different locations that have CDC-recognized diabetes prevention programs. We have programs available here in Laramie County. There's a couple of them in Cheyenne. We have programs available in Douglas. Currently there's 1 program available in Fremont County with another 2 starting up in the near future. There's 1 in Cody, 1 in Jackson. And then we also have additional programs that aren't on the map here that are in the process of applying and getting ready to start. There's 1 in Casper. I know there's 1 in Sweetwater. So there's quite a few more programs that are really starting to apply to the CDC for their recognition and implement these programs. Additionally, there's online programs available, and these online diabetes prevention programs are equally effective or as equally effective as the in-person programs. So here's our second polling question. Have you ever referred patients to a National Diabetes Prevention Program? So it looks like, again, the large majority have not referred patients to a national diabetes prevention program, which isn't surprising seeing as the large majority of participants from the first poll weren't aware of the program. We have had a couple people refer and a few people who are not in a role that refers patients. So now I'm going to go into details on this Prevent Diabetes Stat Toolkit. And this is really the toolkit that is available to help providers, clinicians, other healthcare professionals ensure that patients are referred to these programs to help them reduce their risk of diabetes. So in Prevent Diabetes Stat, the STAT stands for Screen, Test, and Act Today. This is just the front cover of the toolkit, and this is available online for free. My program also has them printed and bound available, and we ship them out for free to anyone who wants them. It's a great toolkit to have on hand to be able to hand out to your partners. Maybe if you're someone who doesn't work directly with patients, but you are involved with providers or other clinicians that do work with patients, it's a great resource to make available for them. And then it is also available as a download in the file section for this presentation. I believe it is labeled, let's see, it's up there in the files labeled Prevent Diabetes Stat Guide. And you can download the full guide there. So like I said, it's a guide to help providers refer patients with prediabetes to an evidence-based diabetes prevention program. This was a joint project by the AMA and the CDC, and it contains quite a few different tools to help healthcare providers go through each of the steps in preventing diabetes stat. So helping providers screen patients for prediabetes, test patients for prediabetes, and then act today by referring patients to an appropriate diabetes prevention program. And then the website where you can find all of these resources is preventdiabetesstat.org. Now, this presentation today is tailored towards the provider. However, if you go to the website, Prevent Diabetes Stat also has resources and toolkits available for employers and insurers, for community partners and patients. So it has quite a few other resources out there that you can look at and explore and see what can be used in your practice. So an overview of the tools provided in the toolkit. First, the toolkit goes through tools helpful to engage clinicians. So if you're a practice manager or maybe a champion in your practice who really is passionate about preventing diabetes and are trying to get other people on board with joining forces with you to help screen, test, and refer patients, there's some handy provider fact sheets in there that give an overview of the National Diabetes Prevention Program, the importance of partnering with programs in your area, the improved outcomes that you can see in patients by referring patients to these programs. And then it also gives a few different resources on how you can actually interact with other clinicians or other healthcare providers in your area to show them the value of incorporating these tools into their practice. It has quite a few tools for engaging patients. That's definitely one of the most important steps in preventing diabetes. You, of course, have to have the patient involved. The patient has to be motivated to change and on board with this care plan. So the toolkit includes a prediabetes risk test to help screen patients for their risk of diabetes. There's a poster in there, or it's an 8x11. It's something that can be printed at a larger scale. They also have a couple of patient handouts. So a handout to inform patients who may be at risk for diabetes or help them understand if they have risk factors. And then another handout for patients who you have diagnosed with prediabetes. So you have prediabetes, now what? The toolkit also includes quite a bit to help practices incorporate screening, testing, and referral into their practice as a standardized procedure. And we'll go over a few of these today. It talks about a map, which is a one-page roadmap on how you can actually incorporate these into your practice. It talks about a couple of different identification methods, either point of point of care identification of patients who have prediabetes or retrospective identification of patients who have prediabetes. It also has a sample letter, email, and phone script. So once you've identified those patients, it gives you a sample template to help reach out to them, as well as a referral form, and then some CPT and ICD-10 codes for the actual billing process. So the toolkit really does incorporate tools for every person in a practice, whether you're the practice manager, whether you're the billing or coding specialist, whether you're the patient navigator, a physician, a nurse. It includes tools for everyone. And then lastly, it includes a sample business associate agreement. So this is if you really do have a strong partnership with a national diabetes prevention program in your area and would like to formalize that partnership, you can go as far as using a business associate agreement to develop an official relationship with that diabetes prevention program in your area. So another question that I'm interested in finding out is, as a practice or as a provider, what information do you need to know about a community-based program before you consider referring patients to it? And this is something you can just type into the chat box. It's not a polling question. But I know, of course, providers often want to know some details about programs and how it may benefit their patients. So I'm curious what you guys would like to know about programs before you're okay with referring patients. Cost of a program, that's definitely an important one. Yep, cost. The training of the providers that offer those programs, okay. Requirements for attendance. Okay, so I can address a few of those just to give an overview, and especially for how it relates to a diabetes prevention program specifically. The cost of a diabetes prevention program is going to be unique to the specific program. So this program doesn't have a cost that the CDC requires. Many programs offer scholarships for patients who cannot afford to attend the program out of their own pocket. Oftentimes, a lot of our newer programs that are starting up are implementing incentive-based payment systems where a participant may pay $20 for a session, but if they're successful in completing the program and obtaining that weight loss that they hope to obtain through the program, they get that money back. So it's a little bit of an incentive to participate and do well in the program. In terms of the training of those that offer the National Diabetes Prevention Program, in order for a program to become certified, a National Diabetes Prevention Program must have trained lifestyle coaches. To become a trained lifestyle coach, it is a 2-day, 12-hour training, 6 hours a day. And this training goes over effective tools on how to follow the curriculum, on how to best provide the curriculum to participants, how to engage participants in the program and really motivate them to complete and do well in the program. And then for attendance, it's up to the participant how much they want to attend. In order for a diabetes prevention program to maintain their CDC recognition, they do have minimum participant attendance that they have to meet. So they have to have a certain percentage of participants complete a certain percentage of the classes. The participant, of course, is not obligated to do that, but it is an incentive to them because their outcomes are greater with higher attendance. And all of these are certainly, I can direct people to the diabetes prevention program closest to them, and each diabetes prevention program has resources that explain a lot of these things, and most of our diabetes prevention programs in the state are willing to come to a practice, sit down with providers, maybe do a lunch and learn, or offer a brief presentation, and really answer all the questions that everyone has about their program. So looking at engaging clinicians, so of course it sounds like most everyone, in order to refer patients, wants to know what a national diabetes prevention program is, how a patient would benefit, And then also some of these other details like cost, training, things like that. So the Prevent Diabetes Stat Toolkit does have a clinician fact sheet that goes over quite a few of these details. And then another important thing is to understand who is eligible. Now, I will put in a disclaimer here. The Diabetes Prevention Program standards were just updated this year, and the AMA and the CDC have not yet released an updated toolkit. So everything in the toolkit is up to date except the eligibility guidelines. There's one small change. So I will go over the new eligibility guidelines here in a second. This is the clinician handout that kind of just goes over everything a clinician may need to know before wanting to refer a patient to the program. Eligibility for the program, there are a few requirements. All patients of a diabetes prevention program must be adults. They must be 18 years of age or older, and they must have a body mass index of 25 or more, or if they're Asian American, 23 or more. Now this is the change that the CDC made to the standards, and so when you look in the toolkit does have the outdated guidelines of 24 or 22 if Asian American. So that's the one main change between the toolkit and what the current standards are. And then on top of meeting those minimum requirements, a participant can be eligible one of two ways, either through a blood test or a screening using the prediabetes screening test. Now there's a few different blood tests that can make them eligible: fasting glucose test, a plasma glucose test, or an A1C level. They can also be considered eligible off of a blood test if they were diagnosed with gestational diabetes, and that does not have to be in the past year. That just has to be within their lifetime history. And then the other way is a simple one-page prediabetes screening test, which I'll go over here in a little bit, where they answer a few questions about family history, other chronic diseases, what their weight and height are, and it gives them a risk score, and that risk score can make them eligible to participate in the program. Now, all participants of a diabetes prevention program cannot have a previous diagnosis of type 1 or type 2 diabetes prior to enrollment. If they've ever been diagnosed with diabetes, they are not eligible to participate. So some of the tools that are provided in the toolkit, like I mentioned, there's a poster. And so this is a poster that can be printed out on a larger scale and hung up in a waiting room of an office that really just goes over what some of the risk factors may be. So it draws in patients' attention of, quite a few people have prediabetes, and they could be at risk if they have high cholesterol, high blood pressure, a family history, and it prompts them to ask your doctor how you can stop diabetes before it starts. And then on the right there, we have the prediabetes risk test. That's that simple risk test I was just talking about, where the patient just answers a few simple questions, and it gives them a little answer guide. So, if you're a man, it's a risk of 1, as opposed to if you're a woman, it's 0, because men are at higher risk for diabetes. If they have high blood pressure, that gives them 1 point for higher risk. And a few other questions to help them really come up with what their overall risk is for diabetes. Now this is another handy tool that can be used in the waiting room of a clinic, or perhaps in when the patient gets taken back to a room after the nurse, medical assistant, nursing assistant, after whomever it is that takes their vitals and checks them in, they could hand them the risk test to fill out while they're waiting for the provider to come into the room. So there's a few different ways this could be implemented in a practice, and it's a very simple test, very easy for patients to navigate, to really help them start asking that question of, could I be at risk for diabetes, and do I need to talk to my provider about it? There's also a couple of handouts provided in the toolkit. One that informs patients or gives them a little bit of info about if they may be at risk, and another one that says, so you have prediabetes, now what? So kind of a before the visit and after the visit handout to give patients a little bit more info about what they might need to do or what they might need to know more about. And then lastly, the Chronic Disease Prevention Program at the Department of Health has some prediabetes posters that we developed that are Wyoming specific. So some of the posters out there that were developed as part of this national campaign weren't really applicable to Wyoming. We realized that, these posters, if they were put up in a Wyoming waiting room, wouldn't really apply to most people that walked through that waiting room. So we did put together a few different posters, Wyoming specific, one targeting people that would rather be out hunting and fishing, one targeting people that know every single verse of Ragtime Cowboy Joe, and one targeting the person who wears brown and gold 7 days a week. So we have these Wyoming-specific prediabetes awareness posters, and these are available for free. We have them printed full size. I believe they're like 16 by 24 inches, or I don't know, some standard poster size. But we do have these available for free for any practices, healthcare providers, or even, libraries. Anyone that wants to hang them up and draw awareness to prediabetes, we can ship them out to you for free, and I will go over the order form. The order form is in one of your files that you can download. It's the DPP supply order form. So if you're interested in some of these posters to really engage your patients and draw attention to the risks of diabetes, you're welcome to submit an order. You can order as many of these as you'd like. You can request specific ones. It's up to you. So implementing diabetes stat in your practice, it really is more than just these posters and handouts. No matter how many posters you have in your waiting room or in your clinic visit rooms, or however many handouts you provide to patients, you really do need engagement from the full practice team, whether that's your nurses, your billing people, your practice managers, your providers, pharmacists. Anyone involved with your patients should be involved in this practice or in this process. So the toolkit goes over creating a map for screening, testing, and referring patients. This map stands for Measure, Act, Partner. And the map helps you determine specifically what the roles and responsibilities are in your practice for identifying patients that are at risk for diabetes and referring them to the appropriate service. So here's another question I have. This is a polling question. Does your practice have a standardized procedure for identifying patients at risk for diabetes and referring them to appropriate resources? We'll get that polling question started. So it looks like most people said no. Almost 50% of people said no, we don't have a standardized practice. About 25 or about a quarter of the participants said yes, we do have a standardized procedure, and then a quarter said not sure. So I'm going to go over now the map, which can help practices actually develop a standardized procedure for identifying, screening, testing, and referring patients to diabetes prevention programs. So this is a tool that is in the toolkit. I did put it as the single PDF in your downloadable documents. It's the Map to Diabetes Prevention for your practice. And so this is something I recommend maybe during a meeting, a staff meeting of everyone at the practice, or a management meeting. You print out and you go through and you actually look at what you're currently implementing and what you could change in your standardized procedures at your practice. So we'll go through this in detail. It goes through the 3 steps of measure, act, and partner. So the first step is measure. And there's 2 ways to do it. There's the point of care method or the retrospective method. Point of care would be as the patient is in the office, screening and testing those patients that are in the office at that moment and identifying patients at risk as they're there for their visit. The retrospective method would be a great idea for practice is that you do see quite a few people who are likely at risk for diabetes or are already diagnosed with prediabetes. And this is a method that you can use with your IT people or your quality improvement people to search through your EHR and actually find patients that meet requirements for referral, and then reach out to those patients that you've seen in the past. They're not in the office at the moment, but identify patients that would be eligible for the program. And again, as you'll see in here under the retrospective method, it does in the toolkit use the old guidelines of 24 and 22 for BMI. So it's important to remember that those have been updated to 25 and 23. The next step is acting. And again, they split up ACT into two different ways, the point of care method and the retrospective method. So this is once those patients have been identified, whether it's in the office through a test or retrospectively by searching your EHR using certain queries, how are you then going to act on that prediabetes diagnosis or that diabetes risk factor? Within the office, that could be counseling patients about what their options are, could be referring patients to a diabetes prevention program, and depending on your relationship with that diabetes prevention program, if you have a business associate agreement and if you have patient permission, even going as far as sharing that specific patient info with the diabetes prevention program to help connect that referral link there. Retrospectively, this is where you might use that letter template or that phone call template to contact patients. So once you've actually identified patients you've seen in the last 6 to 12 months who are at risk, using some of the tools in the toolkit to reach out to those patients and let them know that you've identified them as someone who is eligible for the diabetes prevention program. And then the last step is partnering. So again, there's two ways to partner. You can either partner with diabetes prevention programs or with patients. And with all of these, you can do one, the other, or both. Now, it's important to partner with diabetes prevention programs since you're going to be referring patients to them. So establishing contact with the program, being familiar with maybe their schedule of offering classes, what their costs are, if they're a program that offers scholarships for patients who cannot afford the out-of-pocket cost, and coordinating with them to really understand what the most efficient way is to get referrals to them. There's patients who are lost in that referral process, but if you've partnered with that diabetes prevention program in your area and set up a standard procedure with them on how you will refer patients, you're going to have fewer patients that are lost in that referral link. And then, of course, you're partnering with patients throughout this process. So using motivational interviewing or identifying other motivating factors that are important to that patient. Following up with them, so the next time they come into the office, if you've already referred them, following up on that referral to determine if they have started attending the program. And then also working with that patient to get their feedback on the program if they've attended, and perhaps integrating what they're doing in the program into their care plan so that you can partner with them and help support the changes that they're making through the diabetes prevention program. Now, the toolkit does give a really handy map to help walk you through the process for both point of care and retrospective identification of patients. So if you're going with the point of care method, it helps you identify, okay, first the patient must be over 18 and not currently have diabetes. If that's a yes, you move on down. Then you want to make sure their BMI meets the criteria. If that's a yes, you move on down. Then you can look and see if they've had an HbA1c, fasting plasma glucose, or oral glucose tolerance test in the last 12 months. If they have, you can look at those results. If they haven't, you can order one. And then depending on those results, it tells you how to act. So if they fall within the normal range, great. They're doing awesome. You don't need to refer them. If they're pre-diabetic, that's when you would follow through with the referral to a DPP. And if they do fall into that diabetes range, then you have a patient who's been recently diagnosed with diabetes, and you can move forward with your counseling, potentially referring them to a diabetes self-management program, and then initiating therapy for a diagnosis of diabetes. And then lastly is that partner piece. Again, you're partnering with, ideally, both a diabetes prevention program and your patients. And then the toolkit also provides the same thing for the retrospective method. So again, this is when you're searching your EMR or your patient database to look at patients that you've seen in the last 6 to 12 months who are maybe missed, and it turns out they are at risk or were diagnosed with prediabetes but were not referred. And it gives you some inclusion and exclusion criteria you can use when searching through your EMR system to generate a list of patients. Then using that list, again, contacting those patients and sending them info about a diabetes prevention program. Or you could potentially just flag their medical record so that the next time they come in, you know you need to speak with them about it. And then lastly, there's the partnering piece, again, where you're working, because you're identifying patients retrospectively, they're not in the office at the moment, making sure you're partnering with the patient at the very next visit when they are in the office. So we've got our final polling question here, now that we've talked about both point of care and retrospective identification of patients. I'm curious to know what method of measuring are you more likely to use in your practice? Point of care, retrospective, or both? Oh, there we go. Now it does. So it looks like most people attending the webinar today are most likely to use the point of care method. It definitely is an easier method to integrate into a practice if you don't have perhaps someone who is, strong with working with your electronic health records or your electronic medical system or medical record system. A couple people who had said retrospective and one who would do both. Okay. So now we want to look at actually developing a map. So this is one of your downloadable documents in the webinar. If you want to open that up, or you can pull up the PreventDiabetesStat.org website, this map actually goes through, and it's really easy. You can fill out in person, sit there and circle what you're planning on doing. And so the map goes through those 3 steps: measure, act, and partner. So the first thing to do, which we kind of just did through the survey, would be to identify if your practice would like to use point of care measurement, retrospective measurement, or both. It sounds like most practices are interested in using just point of care measurement. So then you would go through each of those steps, step 1 and step 2 for the point of care method, and actually look and see who is responsible for each of the selected tasks and when. So most of these have standard wins, so you're going to be counseling the patient during the visit, or you're going to be assessing their risk, maybe during the vital signs. But looking at who is actually responsible for this. Because if you're able to develop a standardized procedure where in your practice you've determined that assessing risk for prediabetes is a responsibility of the medical assistant, and that medical assistant knows that they need to do that every time when they're taking patient vitals, it's a lot easier to ensure you don't miss patients who are pre-diabetic or at risk for diabetes when you have that written standardized procedure. Again, looking at step 2 in acting, so this would be when you're actually counseling the patient about prediabetes and referring them to a diabetes prevention program. Who is responsible for that? Is that maybe the physician who gets to do that when they meet with the patient? And that could even be something as simple as sending the patient to meet with a patient navigator, if you have a patient navigator, or sending the nurse back into the office. And it can be broken up between different people. So the physician may be responsible for counseling the patient, but then perhaps the receptionist is responsible for referring the patient when that patient goes to check out of their visit. And so going out and filling out the map will actually help develop these written standardized processes for each practice. And then finally, for each one of these steps, it's important to note how a practice will do it. And so are there standard tools that you're going to pull out of the toolkit and use? Do you want to collect referral forms from the DPP in your area and have copies of that available? Having the how figured out for this process is also important, because then you can identify what tools or info do you still need. And then, of course, identifying your partners throughout this process. What diabetes prevention program or diabetes prevention programs will you be working with? And this is something you can, like I said, you can print out and bring it to the next staff meeting, management meeting, something like that, and go through and actually figure this out and then compile a written standardized procedure for the clinic. So I have another chat box question. Knowing now the information provided in the toolkit and the process for screening, testing, and acting today to diagnose and refer patients to diabetes prevention programs, what is the most challenging aspect of this within your practice? And you can just type it in the chat box. I'm curious to know what's going to be most challenging about incorporating this process into your standard practice procedures. Yep, time constraints. That's definitely a very, very common issue. Also, counties that don't have diabetes prevention programs yet, that as well. And that's something that one option is to look at the online diabetes prevention programs available. Of course, the referral process will be a little bit different then. It'll be providing patients with information about the online programs. And you do get a copy of the presentation slides. It is one of the downloads. And on the slide that has the map of the DPPs in Wyoming, on the side there's also the link to where you can find the online programs. So that's something you can look at to search and see what programs might patients have access to online. Access to the program, yep. And so, like I said, for patients that might have limited access, there are quite a few programs that are providing scholarships. We also have programs that are looking at providing things such as transportation assistance. Other programs have considered child care assistance. So as we're working with programs at the state level, we're really working with them to make sure they consider all of these different barriers that patients may encounter when they're looking at attending one of these programs. All right. So moving on, why is this important? So of course for the patients, there's significant value for the patients. Patients who attend one of these programs do have improved health outcomes, reduced incidence and prevalence of diabetes. So we're seeing a reduced incidence. Fewer people are being diagnosed with the disease because they're able to recognize they're at risk and prevent that diagnosis. And then as a result, our overall prevalence rate of diabetes is going down. You also see better patient satisfaction when a patient feels like their healthcare providers are really referring them to all the resources possible to better help them improve their health outcomes and their quality of life, and that improved quality of life that comes from attending the program and preventing a diagnosis of diabetes. There's quite a few different values to the clinic. One example I pulled up here is if you're a patient-centered medical home. And this is just one example of many, but PCMHs do require certain things like team-based care, care coordination, evidence-based clinical decision support. And so if you're a practice that's a PCMH or interested in applying to be a PCMH, these are all things that are required to be met in order to obtain that recognition. And then for other clinics as well that maybe aren't PCMHs or aren't interested in obtaining that recognition, there's different benefits related to performance measures about referring patients to community-based resources and things like that. And then there's increased income. Quite a few patients could be screened for prediabetes because they're at risk and aren't being screened, and so of course these additional screenings are additional income for a clinic. And then there is the value to the community. When you have healthier people, you have a healthier population and a healthier workforce. Some of the other helpful resources that I mentioned, but I just want to emphasize, are the patient letter, email, and phone script provided in the toolkit. There are standardized referral forms. Now, there is a referral form provided in the toolkit but it does have those old eligibility guidelines on it. So our program, the Chronic Disease Prevention Program, has put together a referral form that has the new guidelines. It is uploaded as a document. It's labeled CDPP referral form. You're welcome to download that, and that does have the new eligibility guidelines on it. And that's something that can be used to then refer patients to a diabetes prevention program. And then lastly, we have the Cowboy Up to Prevent Diabetes Toolkit. Now this is something Wyoming specific that we've put together that includes a lot of these different tools I've mentioned. So we have these printed and bound Prevent Diabetes Stat Toolkits available if you prefer a hard copy that you can hold in your hand, put on the shelf, etc. We also have laminated prediabetes risk tests. So one of the tools that we found really helpful in a clinical setting is having these laminated tests that then patients can fill out in the waiting room. So after they sign in to be seen, while they're waiting to be called back by the nurse or medical assistant, if the receptionist is able to provide them this risk test and a little dry erase marker, they can fill it out, take it back with them, and then the nurse can erase it and bring it back to the front desk, and it can be used again. And then we do have those prediabetes awareness posters, the Wyoming-specific ones that I showed you the pictures of. And all of these are available to order for free from the program. The order form is one of your downloadable documents and can just be faxed to our program anytime you would like to order the resources. And then lastly, the toolkit does include some billing and coding resources that are helpful for the billing and coding people in your practice that are related to some of these screening and testing processes as part of preventing diabetes stats. We have both the CPT codes and the ICD-10 codes. So as a final question, I'm curious, what else does your practice need help with to best meet the needs of your patients at risk for diabetes? What else can either we provide at the state level, or what support can Wyoming Primary Care Association provide? Is there anything else we can do to better support practices, better support their patients? And while I wait for those answers, I'll also open it up to questions. I believe everyone's been unmuted now. You can also type questions in as well if you're on the computer. Okay, so more trainings, okay.
More specific to prevention. Any more questions? Oh, Anne's typing in any. Does anyone else need any other resources like this, or we could offer some specific in this that was offered in this module that we could dive in deeper? Do you want a support group? What do you need? How can we help you? Anything else? All right. Any questions? All right. Well, since I have you captive, I'd like to invite you all to our next webinar called Onboarding New Employees, and it is offered August 9th. Down at the links worth exploring, you'll see the registration link, so please feel free to join us. We're going to have another very special speaker, Ann Hogan, who was the Vice President of Human Resources from Colorado's largest migrant and community health centers. On top of having an impressive portfolio, she's also a certified senior human resource professional. So please don't miss the opportunity and it is August 9th. And if you have any other questions, please let us know. You can email us, and we will send, if you haven't downloaded the attached documents, we will also email them to you. So with no further ado, thank you for your time and have a great rest of your day.
Thank you, everyone.